Good afternoon, everyone. My name is Nirav Shah, and I'm the director of the Maine CDC. Delighted to be able to join everyone this afternoon to provide an update on where we are with respect to COVID-19 for the state of Maine for today, Monday, November 16th, 2020. I begin today's briefing on a somber set of notes. In the past 3 days, Maine CDC has recorded the deaths of 3 additional individuals in Maine. Over the past couple of days, we've been made aware of the death of a woman in her 80s from York County, another woman also in her 80s from Somerset County, and a man in his 80s from Kennebec County. Their passings collectively mark the 163rd, 164th, and 165th deaths associated with COVID-19 in Maine. I'd like to take a moment to offer our condolences to their friends, family, and communities during this time of their grief. Overall, across the state, 9,117 individuals have COVID-19, an increase of 173 just since yesterday. Of those, 8,180 are confirmed cases, and 937 are probable cases. As I mentioned a moment ago, 165 individuals have passed away with COVID-19, and overall, 6,830 have recovered. Cumulatively, 577 people have been hospitalized, and right now in Maine, 69 people are in the hospital with COVID-19, 28 of whom are in the intensive care unit, and 7 of whom are on ventilators. I'd like to take a second to pause there, because I think it's important that we recall that these are 69 individuals, 69 people with families, friends, and communities, all of whom are worried about their loved ones. I think it's also important to recall that this increase in hospitalizations has an effect not just on the patients, not just on their families and communities, but most definitely on healthcare workers across the state of Maine, who are once again seeing a surge in patients, as well as the personal toll that it takes upon them as healthcare workers. Even though during these briefings, we talk a lot about numbers, I think it's important to remember that there are certain things that numbers don't capture, that are hard to quantify by their very nature. And in that vein, one of the most difficult things to quantify is the anguish, the concern, and the fear that comes with having a friend or family member be hospitalized or on a ventilator with COVID, as well as the mental toll that healthcare providers suffer from having to care for COVID-19 patients day in and day out. These things are very difficult to quantify, but as we go through this surge in cases, not just in Maine, not just in the Northeast, but across the Northern Hemisphere, I'd like us all to keep in mind the unmeasurable toll that this is taking, the things that the numbers don't just capture. In short, not everything that matters can be measured when it comes to COVID-19. I'd like to take a second to talk a bit about some of the outbreaks that Maine CDC has opened in just the recent days. And the numbers here are significant. Just today, Maine CDC has opened 3 outbreak investigations. One at Cove's Edge, a long-term care facility in Damariscotta, where there are 4 staff members who have tested positive. We've also opened an outbreak investigation into 3, perhaps 4 cases of COVID-19 associated with Maine Medical Center. And just today, we've also opened an investigation into the Whitefield Elementary School, where we're aware of 1 student and 3 staff members. These 3 new outbreak investigations come on top of 11 outbreak investigations that Maine CDC epidemiologists opened just on Saturday and Sunday. For completeness, I'd like to tick through all of those. We've opened an investigation into the Tabernacle of the Congregation, where we are aware of 3 cases. At the Worcester Wreath Company, also where we're aware of 3 cases. At the Augusta Calumet Social Club, 3 cases. At Clover Health in Auburn, where we are aware of 3 staff members. At Down East Transportation, we're aware of 3 cases. at the Edward Little School, at the Edward Little High School in Auburn, where we are aware of 2 students and 1 staff member. Barrington Elementary here in Augusta, 4 cases. At Lewiston High School, 1 student and 2 staff members. The Little Hands Child Care Facility, where we're aware of one child and 6 staff members. At Northeast Mobile in Rockport, 4 staff members, and at the Otis Elevator Company, where we're aware of 4 staff members. In the past 3 days alone, between Saturday and today, Maine CDC has opened now 14 epidemiological investigations into outbreaks that are occurring across the state. This is significant for a number of reasons, not least of which is that these outbreaks are a direct outcropping of the increasing levels of community transmission that we have started to see in the past couple of weeks. There is a direct link between community transmission, gathering in households, and the eventual emergence of an outbreak. As we've talked about, what we've been seeing for weeks now is that the ground has been seeded with ever increasing numbers of COVID-19 cases, and we're now starting to see patches in the form of outbreaks emerge all across the state. Sadly, that trend is one that may continue. Next up, I'd like to take a moment to talk about where we are with respect to testing. Right now, the 7-day test positivity rate for tests reported to Maine CDC stands at 2.69%, roughly where it was yesterday. Similarly, with respect to testing volume, our current testing volume remains at 606 tests per every 100,000, largely within the same tight band of testing volume that we've seen over the past week. We are continuing to make testing available in different venues, as we've talked about, and as we see more testing numbers come in, that will help us better understand the ways in which the outbreak and pandemic are spreading across the state, and specifically the areas in which they are spreading. I'd also like to talk about 2 things that may have been more in the news that I'd like to comment on briefly. The first is with respect to some additional news and data that we've received this morning around another vaccine candidate. Earlier today, a company called Moderna, a vaccine manufacturer, released and announced some data from its ongoing COVID-19 vaccine trial. This announcement was made after an independent, NIH-appointed group of scientists reviewed the data from the ongoing trial. Based on that review conducted by the independent NIH-appointed scientists, the vaccine showed an efficacy rate of 94.5%. To put that number in to provide where that number comes from, this interim analysis was based on 95 cases of COVID-19 that occurred through the course of the trial thus far. 90 of those 95 cases were observed in the placebo group who got saline. And the 5 cases that occurred were in the group that got the candidate vaccine. That's where we get this point estimate of the vaccine efficacy of 94.5%. This morning, Dr. Anthony Fauci called these results, quote, truly outstanding. The vaccine, as it relates to our planning, has some advantages on top of the vaccine data we saw from Pfizer. This vaccine in particular does not require the same ultra cold storage chain that the Pfizer candidate vaccine does. Now, as with the Pfizer vaccine announcement from a week ago, these data provide reasons for optimism, but we should still demand to see all the data from the entirety of the clinical trials and not base our assessment, let alone our planning, on press releases. Again, press releases should not be what drives scientific and public health policy making. We should be waiting for the full data. Those, I understand, will be forthcoming. But it is a good time to comment upon what these data mean for Maine. The first thing is that the early doses of both this vaccine from Moderna, as well as the previous vaccine we've discussed from Pfizer, will be made available first and foremost for healthcare workers and first responders in Maine. We do that for 2 reasons. The first is that this is the core group who are taking care of ill patients across the state, and we want to make sure we can keep that capacity high. The other reason we start with healthcare workers and first responders is because we'd like to also tap them to make sure they are part of our vaccine force. That's one of the reasons why having them be first in mind for the vaccine is critical. But more generally speaking, these data show now that there is going to be a shift in the conversation from vaccines to vaccination. That's what we at the Maine CDC have been planning and preparing for months now, is the process of administering and distributing the vaccine. Even though these two pieces of data are encouraging, it's important to note that these vaccines will not be available for widespread community administration for many months. That underscores why we cannot let our guard down with respect to COVID-19. It's important that we all continue to use the tools that are available to us today, like wearing a face covering everywhere you might be going, anytime you might be encountering somebody, having a face covering on, maintaining physical distancing, avoiding crowds and gatherings. Even though these data around the vaccine are positive, and even though Maine CDC has been planning for vaccination efforts for months now, we still have a long ways to go. So we can't let our guard down. And I want to make sure that everyone knows that although we are in our planning and preparing phases, we still have a long way to go. And that's why I need all of you to take steps to guard against the virus, even through the vaccine period, as we're waiting for the vaccines to arrive. The next thing I wanted to mention and take a moment to chat about today is where we are with respect to schools across the state of Maine. Let's first start with some of the numbers. Overall, in the past 30 days, we have seen approximately 212 cases of COVID-19 associated with schools. Again, that's over the past 30 days. That's not the number that are active today, but that's the number that are active in the past calendar month. Of those 212, 185 are confirmed cases, 27 are probable. And that number includes teachers, staff members, as well as students. Now, as I walk through some of these data, let me be really clear right at the outset. I do not want to minimize the impact of COVID-19 on those who are affected in school communities one iota. Schools most definitely, whether they be teachers, staff members, and students, can be affected by COVID-19, and I do not want to minimize that impact one bit. But what I do want to discuss today is what we know right now with respect to transmission of COVID-19 in schools versus COVID-19 in school communities. And again, the distinction I'm drawing here is one between finding COVID-19 in schools and finding transmission of COVID-19 in schools. Over the past now 2+ months into the school year, we have thankfully seen little transmission of COVID-19 within schools. That's an encouraging finding and a clear sign that many of the difficult steps that educators, school officials, and parents and students themselves have been taking are working. These are things like wearing face coverings in school, having plexiglass up to prevent the virus from moving, engaging in physical distancing in the classroom and throughout the school. And of course, what we all know has been challenging, which has been pausing or changing the nature of certain extracurricular activities. What I want everyone to know is that those changes are having an effect. What we have detected thus far into the school year is very little transmission of COVID-19 within the four walls of the school. Yes, we have detected cases of COVID-19, but not many instances of spread or transmission within the four walls of the school. This is an important thing. This is an important distinction because keeping kids in schools for in-person learning continues to be one of our priorities right now. The fact that we have not detected widespread transmission in Maine underscores the fact that in-person education can be done and can be done safely. Now, I want to be clear. I am not claiming that there has been zero transmission, nor am I claiming that there will never be any transmission. But what I am, based on the data we have seen to date, suggesting is that the level of transmission that has occurred in schools has been thankfully very low. Now, some of the numbers that I've mentioned, 212 cases of COVID-19 associated in the past 30 days with schools, that sounds jarring. But bear in mind that much of what that number represents is a function of what we are seeing of transmission in the community. I'll say that again. Much of what we are seeing with respect to the numbers of cases of COVID-19 in schools are a direct reflection of the rates of transmission of COVID-19 in the community. To put that somewhat differently, much of what we have seen in Maine with respect to COVID in schools is what we are seeing based on the community. The two have a close relationship. And thus far, we've detected cases not because they have been transmitted or contracted in schools, but merely because that's where more individuals are being tested and where we are focusing our eyes upon. The other implication of these data is that one of the best ways to keep kids, staff members, and teachers safe is to reduce the overall levels of community transmission. To put a finer point on that, if we want to keep kids in school for in-person education, the best thing that we can do is to keep a lid on community transmission. And the best ways to do that are going back to the basics we've talked about for months now. Going back to those face coverings, going back to talking about physical distancing, going back to avoiding crowds and gatherings. If we can keep levels of community transmission low, we can keep levels of COVID in schools low, and thus avoid the possibility of transmission occurring within schools, which would sadly have other consequences. So that's where we are with respect to COVID-19 across the state, both in terms of the numbers, both in terms of the impacts on the healthcare system, and where things stand in schools as well as on the vaccine front. So with that, I'm going to turn things over to our colleagues in the media and ask Joe Lawler for the first question for today.
Yes, hi, thank you for the update. My first question is about the vaccine, Moderna versus Pfizer. I know you said that the cold storage requirements for Moderna are much lower. I mean, they don't need to be kept as cold. So what does that mean in terms of distributing the vaccine? Will the Moderna vaccine be distributed to different populations in Maine as compared to the Pfizer vaccine?
Quite possibly, Joe. So let me first comment on the differences and why that matters. As your question noted, the Moderna vaccine does not require the ultra cold minus 80 Celsius degree type storage that the Pfizer vaccine does. That has some immediate implications. The first of, and what the Moderna does require in terms of storage is what we all have in our kitchens, which is a regular old freezer, and then it can even be stored in a refrigerator for a number of days as well, and still have shelf stability and not degrade or deteriorate. That has immediate implications. The first, of course, is that we don't need to have the same degree of parallel ultra cold freezers as we will for the Pfizer vaccine. Those freezers have become hot commodities. Now, we ordered ultra cold storage freezer units in Maine long ago, but it's always great to have something that doesn't require that. This also changes where the vaccine can be used. The Pfizer vaccine is one where, for the most part, we want to bring people to the vaccine because of that storage requirement. But with the Moderna vaccine, we can bring the vaccine to people. So when we think about places in Maine where that ultra cold storage capacity may be more of a challenge, rural Maine comes to mind. The Moderna vaccine will allow us to vaccinate in those areas more quickly with more equity. So I don't know that it will be necessarily different populations, Joe, but I do think it will be different geographies within the state, which of course does mean different populations with specific and added benefit to more rural areas of the state.
Okay, and my follow-up question is, I saw in the New York Times you were quoted as saying that we need more federal money to distribute the vaccine. Do we know how much money that we need in Maine? And if we don't get it, what does that mean for distribution?
Sure. So, Joe, let me, yes. So additional funding is needed at the state level across all 50 states. Maine is included. We need the funding for a couple of different categories of things. The first is for vaccinators. It's all great to have a vaccine, but we've got to have folks who can administer it. So that's one category. Another is the logistics. As we've just been talking about, the logistics around these vaccines are immense. Funding for that is important. We also need to have a great IT system so we know where the vaccine is, who's getting it, and making sure we can remind them that they've got to come back in 21 or 28 days to get their second dose. All of this is really critical to making sure we can instill and engender confidence in the vaccine. We're still trying to figure out exactly what we will need in terms of exact funding. The reason that that number it remains nebulous is because we don't yet have all the data around, for example, storage requirements, things of that nature. So that's why we need more data from the federal government, clinical as well as storage. That'll help inform our funding needs. But what's at stake here is really critical, Joe. What's at stake are two things: velocity and equity. That's what this comes down to. Without that funding, we'll still get the job done. That's what we do in health departments. This is what we do at the Maine CDC. We'll get it done. But the funding ensures that we can do so with velocity and with equity. That's why the funding is so critical. I'm going to turn next to Morgan at WABI.
Hi, Dr. Shah. My question is questions. First question is about testing. I'm wondering if testing is backed up at all, and what sort of impact, you touched upon it, but the impact that the testing specifically and the higher numbers of people being tested is putting on healthcare professionals.
So Morgan, let's start with the latter. The testing is critical. And it is one of the reasons why in Maine, because our testing volume overall is robust, it is one of the reasons that we are able to detect cases as well as detect outbreaks, like the 14 outbreaks that I mentioned a moment ago. But make no mistake, that testing also generates diagnoses among individuals who need to be hospitalized, be placed in intensive care, in some cases be put on ventilators. All that places an immeasurable psychological toll on healthcare workers across the state. And we haven't talked about that in a while, but as all of these numbers are ticking upwards, I would just ask us to keep in mind the immense psychological toll that seeing patient upon patient places on healthcare providers. Thankfully, our testing architecture remains strong. The Maine CDC laboratory is regularly turning around 2,000 tests per day, and other laboratories across the state, commercial and hospital laboratories, are also increasing their volume. I don't have the latest data around turnaround times, but we have seen a bit of a plateau in terms of testing volume, and we're hoping to see where that goes. If the case numbers increase, we may need to take steps to expand testing even further.
Is there a backlog of tests right now awaiting results?
I'm not aware. I mean, our laboratory is always getting tests and always processing them. We are always attempting to try to keep to that 48-hour window. If we get a significant number of tests, say, as we typically do on different days of the week, Tuesdays, Wednesdays, there might be a little bit of the 48 hours may go to 50 or 55 or so. But no, I'm not aware of a significant backlog.
And can I just ask you, we were hearing that there could be 4 cases of coronavirus at Varney GMC in Bangor. Is that anything you're aware of?
It very well may be the case. You know, Morgan, we're getting to the point where there are going to be cases everywhere. So it's very possible that there are, and our team is working on that. But and if so, and if there is an outbreak investigation, we will let folks know. But this is going to be happening everywhere. So the notion that a couple of cases somewhere will be, something noteworthy, it's happening across the state. Again, just in the last 72 hours, we've opened 14 outbreak investigations. The pot is starting to boil over and the bubbles are coming up everywhere.
Thank you.
I'm going to turn next to Amy Brown.
Thanks, Dr. Shah. There's been evidence that at least some people are able to contract the virus a second time after recovering the first time around. And so there are questions about how long immunity lasts. And I'm wondering how that relates to a vaccine, if they function differently, if it can be known ahead of time, how long immunity from a vaccine will last, or if that's something that you just have to wait and see.
Yeah, Amy, I don't know that we want, so I'm aware of literally a handful of confirmed cases in the literature where someone has been reinfected and proven to have been a reinfection as opposed to someone who just didn't clear the virus the first time. So I don't think this is the norm at all. Is it possible? Yes. Again, I think it's been documented a handful of times. In many of those instances, it has been somebody who traveled and was potentially exposed to a very, very slight variation on the virus. A couple of base pairs of RNA were just a little bit different. But it is definitely not the norm that reinfection can happen. Based on everything that I've heard Dr. Fauci discuss, reinfection is not the typical course of events. And thus, again, according to Dr. Fauci, doesn't really impact what we think of in terms of vaccine efficacy. Even if it were to become more of a concern, it's all the more reason for as many people to be vaccinated as possible to reduce the likelihood that reinfection could generate new chains of transmission.
Okay. And regarding the situation with Northeast Mobile Health, they had 3 asymptomatic workers who tested negative using the Binax test and then tested positive on a PCR test. Are the Binax tests that unreliable, or do you think that was a matter of the timing of the test?
I haven't studied the timing of their test, nor have I spoken with them to know when they administered it and whether all protocols were followed. So the Binax test is not that unreliable, and I don't think we should sort of use a N of 3 to figure out what we think of the test going forward. We've utilized it across the state with great success, and although it does not have the same accuracy as PCR, what it offers instead is speed and the ability to conduct repeat testing, which from an epidemiological perspective is quite important.
Is this one of the ones that's more likely to give a false positive than a false negative?
So the false positives are, no, it's not that one is more likely than the other. The sensitivity of the test is about 97.5%. Specificity is about 98%. So there will be slightly more false negatives and slightly more false positives. As the epidemiological situation in Maine changes quite rapidly, false positives become less of a concern, but it's still a very, very good test. That's the bottom line.
Okay, and just quickly.
So, and I don't want to for a second cast aspersions on the utility of the test. It is a very valuable piece to our arsenal.
Great, okay, thanks. And just quickly, any update on Kids Peace and Ellsworth, number of cases there?
The number of cases at Kids Peace and Ellsworth remains at now 20 cases.
Okay, thank you.
I'm going to turn to Charlie at the BDN.
Yeah, hi, Dr. Shah. Thank you. I'm following up about the vaccine distribution for COVID-19. Do you have any specific dollar figures you could give of what the federal government has so far provided to Maine and where you would want that to be?
Sure, Charlie. Thus far, for our vaccine planning, Maine has received approximately $800,000 from the federal government. I'll get you the exact dollar figure, but it's approximately $800,000. As I mentioned with Joe, certainly more is needed. And the lower bound and the upper bound of what we'll need really does depend on what the characteristics of the vaccine are. How much storage is needed? How long can the vaccine live outside of a freezer versus a regular refrigerator, et cetera? That's going to drive what kind of materials and logistics we'll need. For example, how many ultra cold storage units will we need? How much dry ice are we going to need? That's the level of planning that we're at right now. For example, One of the things the team and I talked about on Friday was literally how many pounds or tons of dry ice we would need. And then where are we going to get the ultra insulated gloves and goggles to protect the people that are working with the dry ice? It turns out that those ultra cold dry ice gloves and goggles are very pricey, as they should be. They're keeping people safe. But if the predominance of vaccines are going to require dry ice and ultra cold storage, that's going to take us down one pathway with respect to expenditures. If they don't, then it goes in another way.
Okay. And then just one other quick follow-up. You mentioned, so has Maine CDC already acquired one ultra cold freezer? And I know you mentioned last week that you're still trying to get to at least two, I think, but is that on top of ultra cold space you already have?
That is correct. So we already have ultra cold space in one of our facilities, but it's currently in use by that facility for other public health purposes. So we have ordered and received confirmation of an order for 2 additional ultra cold units that will be placed at locations where we can deploy the vaccine from. The other thing we've done, Charlie, is work with our colleges and universities. Although ultra cold storage is something that is being talked about a lot now, in the laboratory and biological world, ultra cold storage is a commonplace thing. It's in use in any type of situation where samples may need to be put into deep freeze. So we've reached out to and have gotten great responses from our college and university partners to give us a sense of what they've got in terms of ultra cold storage space. We are looking to see whether vaccine can be strategically positioned in some of those areas as well, in what we're thinking of as a hub and spoke model. So the vaccine could be potentially placed in certain locations and then be distributed to smaller areas thereafter. So that's something that's under development right now. To give you a sense of where we are in the planning and the granularity, Charlie, we're at the point right now where we've inventoried who's got ultra colds, and now we're asking them literally, how many open cubic feet of storage do you have in that? So we can calculate how many vials could fit into that. So that's the level of planning where we're at right now.
Thank you.
I'm going to turn next to Patty White at Maine Public.
Thanks, Dr. Shah. For the outbreaks, the 14 outbreaks that you've opened within the past 72 hours, you said they're an outgrowth of community transmission, but are there any other details that you can tell us about how these outbreaks transpired that would be helpful to help people envision scenarios to avoid?
Okay, so thanks for that question, Patty. I've been thinking a lot about this because I've been looking at these just 14 outbreaks and trying to determine whether there's a common thread that runs through them. Previously, last week we saw a significant number of outbreaks in Western Maine, and then there were a significant spike in long-term care facilities. But really, in the last 72 hours, it covers the waterfront. Long-term care, healthcare, schools, social clubs, you name it, workplaces. It's across the spectrum. And so, Patty, what I've been thinking about is what's going on here? And what has started to happen is that increasing levels of community transmission that have been occurring over the past few weeks have themselves started making indoor private social gatherings more risky. The gatherings that we are all used to having. And those indoor private social gatherings are themselves generating more cases in the community. And invariably, folks in the community are coming together at their workplace, at where they may get healthcare, and they are generating these outbreaks. And those outbreaks are then generating more cases in the community. And unfortunately, what we're starting to see is a vicious cycle of cases generating outbreaks, generating more cases, so on and so forth. So we're moving away, Patty, from the nature of outbreaks being sector or location specific, i.e., avoid this type of place. What we're really seeing is the nexus between the outbreaks being driven by community transmission. The one thing that I ask everyone to do to help stop these outbreaks is to intervene in your own world to reduce the likelihood of community transmission. And that starts at home. That starts with the way you go about wearing face coverings as soon as you walk out the front door. It starts with who you're inviting over for gatherings. If we can reduce the transmission events that are occurring there, the rest of that circuit has a less and lower likelihood of propagating.
Are you finding in these situations that people are not wearing face masks, or maybe they're wearing them sometimes, but not all the time?
I think what we've seen is that face covering usage in some of these outbreaks, and I want to stress, at least for some of these, we're only 24 or 48 hours in. And so I don't have all the data. I just want to be clear on that. But even if I zoom back out a click or two, what we've seen is that face covering usage has been uneven. And to be sure, face coverings are directly related and directly linked to higher rates of transmission within households. And then, at least from data from the state of Kansas, face covering usage was related at a population level to the overall number of cases in the community. And those two things, individual levels of transmission plus community levels of transmission, are among the two strongest predictors of outbreaks happening. If you couple community transmission with uneven face covering usage, the conditions for an outbreak are perfect.
Okay, thanks.
I'm going to turn next to Evan at the Maine Beacon.
Hi, Dr. Shah. Thank you. Just a quick follow-up question about vaccine distribution. Just I'm wondering if I'm understanding you correctly. Are you saying that the Moderna vaccine would likely be less costly to distribute in Maine than the Pfizer one, or is it kind of unknown at this point still?
Evan, I think directionally you are correct. Because of the lower cold storage requirements, it will likely be less fiscally challenging to to store and transport. Distribution is largely the same, but storage and transport will probably be a little bit less costly. But the reason I'm hedging is that even the Moderna vaccine does require freezing and refrigeration, but it need not require those ultra cold units. So it will be a little bit cheaper on the Moderna front, but I don't know that financing is where I want to go with this. I think the real benefit is the equity gains, because it can be distributed in parts of the state where transport and ultra cold storage is more difficult. It can have a deeper reach all across the state, whether that's to healthcare providers or non-healthcare providers.
Great. And so going back to the New York Times story that you were quoted in, also in that story, there was mention of a national database for comparing COVID-19 vaccination records state by state. And I was wondering if you could kind of give an update on where that stands in Maine. Is that something that we're part of yet, or what would be the timeline for joining that?
Sure. So Evan, what Evan is referencing is an effort by the US CDC to have visibility, 360 visibility, into where things are with vaccine rates across the country, so that we can all monitor how states are doing. We have received a draft of the agreement that the US CDC would like the states to sign. We're still reviewing it because we want to make sure that any data that we share is proper and has appropriate privacy protections around it. So we're in the process of reviewing it and having discussions with the US CDC. Certainly directionally, again, I'm in favor of the idea of at least state health officials knowing how vaccine rates are on a county by county, town by town basis, so we know where we need to increase efforts, so on and so forth. So that's data that I want, but we want to make sure we're being careful with respect to how and under what conditions we share it with the US CDC. We agree with the goal, we agree with the concept, but the devil is in the details, and that's what we're discussing right now.
Great. And then just lastly, also in that New York Times story, they cited some statistics of some polls about between a third and a half of Americans expressing some hesitancy about taking a COVID vaccine. And I'm just wondering, how concerned are you about that type of vaccine hesitancy, or even outright anti-vaccine sentiment in Maine, and what would be the plan to address that?
I'm concerned, Evan. If there are three pieces, three legs of the stool in order for us to start seeing the light at the end of the COVID tunnel. The first is the vaccine, the second is the vaccination, and the third is confidence. Confidence in the vaccine and confidence in the vaccination process. And as the analogy suggests, if any of those three legs of the stool are wobbly, the entire edifice is at risk. So I'm concerned, as I am about the vaccine and our vaccine planning. You know, Evan, what I think I want to talk about with folks is two things. The first is, to the extent folks don't have confidence in those other two legs of the stool, I want to know why. I want to zero in on precisely what the reasons for the lack of confidence are, because perhaps I've got answers. The other thing, though, and it's implicit in what I just said, is I want to talk about vaccine confidence. I don't want to go into this discussion automatically stigmatizing folks who don't see the vaccine the way I do. And so I'm going to try to talk about why people believe the way they do and what I can do to inspire and engender and foster confidence in the vaccine whenever those are approved and the vaccination process. This is going to be a collective effort. And if right out of the gate as a state, we stigmatize or demonize those who don't see the world the way we do, well, right off the bat, we're not going to get them on our page. So I think it's going to have to be a conversation. And the key question is going to be, why? What are the concerns that you've got? And are there ways that me or anybody else can help you get to that confidence level? That's the way I'm going to be approaching it.
And if I can just quickly follow up, kind of what form are those conversations taking, and are they already underway, or what's the situation with that?
Right now, without knowing the data, let alone which vaccines may or may not receive FDA authorization, it's hard to have granular discussions. So I think what those conversations will take many forms. Some of them will be in various public fora. Some of them will be through discussions of this nature. Some of them may be between healthcare providers and their individual patients. I don't think it will be one particular forum or one particular type of conversation. It's going to have to be a series of conversations in different venues.
Thank you.
I'm going to turn next to Hannah at News Center.
Hi, Dr. Shah. Going off of Evan's question, I guess I'm wondering, what will it take for you to have confidence to take the vaccine yourself, to have your kids take it, and to recommend it to all of your family and friends?
Great, thanks for that question, Hannah. Here's what I'm going to be looking out for. The first is I want to know what the career scientists at the FDA, these are experts in vaccine data and safety. They have been at the FDA for some of them decades. And all they do is specialize in understanding the pros and the cons of any product, specifically vaccines. And what they do is they don't rely on the data from the pharmaceutical company. They don't just rely on the publication that gets printed in a journal. What these scientists do is literally start from scratch, and they recreate all the analysis to see how it squares up. And they base their judgments on their own independent scientific analysis. I want to see what those career scientists say and what their recommendations are with respect to the safety and efficacy of the vaccine. That's number one. The second thing I want to see is what an expert panel convened by the US CDC. It's a group called ACIP. It stands for the Advisory Committee on Immunization Practices. This is a group of expert clinicians and epidemiologists who similarly will take an organic look at the data to figure out not so much whether it's safe or effective, that's what FDA will do, but in what groups different vaccines are the best suited. So going back to Evan's question, this is how we will start to have conversations. Which vaccine works for kids under 12? Which vaccine works for folks over 50? The US CDC's expert independent advisory committee will make those determinations. I want to see what their recommendations are. Once those two things are combined, and I've taken a look at all of those data and those expert analyses, all of which are independent, that's at the point where I will feel comfortable taking the vaccine myself and recommending it to my mom, to my spouse. So that's what I'm going to be looking out for.
Thank you.
I'm going to turn next to Allison Ross at WMTW.
Hi, Dr. Shah. Thank you so much for taking my question. Just two today, and I want to talk a little bit about the surge in cases that we're still seeing So is there anything that we can possibly pinpoint this second surge to? I know we were saying that we saw this coming, but is there any indicators of what or where these cases may have come from? And then just the second question is, how is our PPE situation?
Sure, Allison. Let's start with the surge. The cases are coming from Maine. Let's just start there. And let me be 100% straight with everybody. The cases that we are seeing now are a function of increased community transmission in and across Maine itself. We don't have any evidence to suggest that cases are being imported into the state in large numbers. What's driving much of this, Allison, are two interrelated factors. The first is the weather, and the second is the way in which folks are gathering. The weather does two things. The weather drives more folks indoors, so that's one immediate effect. The other is that it changes things like the relative humidity and other factors, which according to some scientific hypotheses, and they're just hypotheses, could actually make transmission more easy for COVID-19, as happens with other respiratory viruses. So that's one factor. The other is what I referenced, which is the nature in which individuals are gathering. Individuals are gathering more indoors. That in and of itself leads to more cases. But then it doesn't end there. What's happening is that those indoor events are then going back out into the community and generating the outbreaks that we're starting to see, which generates more cases in the community, which means that gathering indoors is more risky, which means that there are going to be more outbreaks. And we're starting to see this cycle, this circuit. And that is what's unfortunately driving the exponential growth that we're seeing right now. With respect to PPE supplies, Allison, our supplies are, I believe us to be in a strong position with respect to PPE. But one big caveat to that, we don't know where the future is going to go with respect to more cases. It is entirely conceivable that in the coming days, we could be seeing, in coming weeks, sorry, not days, weeks, we could be seeing several hundred new cases per day in Maine. That will place increasing strain on our healthcare system, which will then place more demands for PPE. Ever since day one of the pandemic, we have been increasing our stockpiles for PPE because we anticipated that, as with every respiratory virus, the fall would be bad. We saw this coming back in April. And so we've been stockpiling. But based on where this surge goes, even those stockpiles could pose challenges. This is why everybody today can do their part. Help us make sure we don't get to that stage where PPE becomes a premium again. Do your part today.
Great, thank you.
And I'm going to wrap things up for the afternoon with Patrick Whittle.
Thank you very much. I wanted to start by, I have a couple things. I wanted to start by just checking a number. Was it 212 cases associated with schools in the last 30 days? Is that right? 212?
You are correct, Patrick. 212 among students, staff members, and teachers in the past 30 days. That doesn't mean it's 212 active cases today. It's past 30 days.
Right. Got it. And two other things. I think we've kind of exhaustively covered the cold storage issue. I would like to get an idea of, it sounds like we don't have all that we need yet, but it sounds like we're on the way there. Is that a fair way of characterizing that?
I think we're pretty close on cold storage, Patrick, meaning we have put orders in for additional cold storage units. We've received confirmation of those orders, and we've also analyzed that forward-going supply at places like colleges and universities, to the point where we're looking at how many vials can college X accommodate, things like that. So I think when the Pfizer vaccine arrives, our cold storage architecture will be where it needs to be, if not day one, really, really, really shortly thereafter.
And the advantage of the Moderna candidate is that it'll increase equity because it can be transported to parts of the state that are more lacking in cold storage and where transportation is difficult.
You nailed it. That's exactly right. So down east is a concern for obvious reasons. Although cold storage, ultra cold storage down east may be a challenge, everyday freezers and refrigerators are not. And so that all automatically opens up opportunities for healthcare providers first. And I want to focus, Patrick, on just right now, we're still talking about the early phases, phase 1A of vaccine efforts focused on healthcare providers. But even within healthcare providers, equity is a concern. And so, that Down East is a good example of the advantage of the Moderna vaccine, because we can ship it out and it need not be placed into ultra cold storage.
Great. One final thing. So there's an event that happens every year called the Christmas Prelude that happens in the Kennebunk area that draws a whole lot of people frequently from out of state. I would assume it would probably be less this year. But unlike a lot of events, a lot of traditional Christmas events that are happening in Maine, this one is going forward, as opposed to, it's being scaled down and some of it's moving online, but it's not entirely being canceled like things like the Mid-Coast Tree Festival are, which is a much smaller event. And I might sound like the fun police when I say this, but is there a responsible way to have an event like this? Because this is something that typically brings a whole lot of people close together to celebrate.
Yeah, Patrick, I've been thinking a lot about this in connection with all the holidays that we're all looking forward to over the next 6 weeks. And likewise, I don't want to be the Grinch, but for obvious reasons. But this is serious, and it's getting worse. And is there a way to pull off activities of this nature? It does depend very much on the nature of the activity. So I can't speak in a blanket fashion, because it may be possible for some activities to occur in heavily modified form. But I think we're all going to have a really frank conversation with our families about what group activities we engage in. You know, what I've started talking about with my family is not thinking of these things, because it's a downer, right? Let's just acknowledge how much of a bummer it is to end 2020, a year that's already been about as bad as any on record, on a note where the one thing that I think so many of us were looking forward to, the holiday season, may itself have to be bizarre and isolated. It doesn't have to be that way, of course. You can still stay connected. But I've talked to my family about thinking about it a little bit differently, not talking about it in terms of canceling activities, but just postponing activities. And so it's possible that some of the December activities that we all come to love, maybe we'll just have to push them off until April or May, or until such time when the epidemiological landscape has changed. So I'm trying to get my own self into a headspace where I'm not thinking about canceling or even pausing. For me, what's giving me that light at the end of the tunnel is postponing for just a couple of more months when we feel like it's much safer. And then it'll be a lot more joyous. So that's where my head's at, but it's tough. Let's just acknowledge that, right? Let's just acknowledge how brutal and dispiriting it is, especially this time of the year. Where we go from there, we'll talk about it. You know, that's my message for everyone today. We'll talk about it.
Great.
So with that, thank you all for taking a little bit of time out of your afternoon to hear where we are, both respect with the virus, our planning around vaccines, and where things stand with respect to schools. Before I wrap up, I think where I'd like to end is where we started, which is, in many respects, what we are going through now is similar to what we experienced back in March. Later this week, I want to talk with everyone about how, although it appears similar, there are some material differences between today's pandemic and the pandemic from earlier in the year. But I want to end on this note. The effects that we talked about are back. Whether it is isolation, depression, difficulty grappling and coping, to say nothing of the strain on the healthcare system and healthcare providers. Now is the time more than ever for you, if you are grappling with these challenges, to reach out and make sure you're connected with folks. If you're by yourself right now, you don't need to be. Now more than ever, it's important to reach out. If you know somebody who is by themselves and struggling, today is the day to pick up the phone and call them. If you are a healthcare provider and you don't feel like it's easy to reach out to folks, please know that help is available. The DHHS warm line is available for you. Resources are available such that even though we may remain physically distant, we don't need to be psychologically distant from one another. More than ever, that is important. So with that, thank you all for your time this afternoon. I look forward to chatting with everyone again on Wednesday. In the meantime, as always, please be kind and take care of one another.